Phlebotomy Test Study Guide. Question 1. Which is most important to prevent preanalytical errors? Option A, patient comfort only. Option B, correct tube order and labeling. Option C, needle gauge only. Option D, using butterfly needles. The correct answer is option B, correct tube order and labeling. Correct tube order of draw and accurate specimen labeling are the two most critical steps in preventing preanalytical errors, which account for the majority of laboratory errors. Additive carryover from incorrect tube order and mislabeling are the most common and consequential mistakes. Question 2. What is the purpose of a serum separator tube? Option A, prevent clotting. Option B, separate serum from cells. Option C, provide anticoagulant. Option D, preserve whole blood. The correct answer is option B, separate serum from cells. Serum separator tubes contain a gel that, upon centrifugation, forms a stable barrier between the serum and the cellular clot, facilitating easy serum harvest for chemistry testing. The clot activator promotes rapid clot formation. SSD tubes do not contain anticoagulants. Question 3. Which of the following is a common site for capillary puncture in adults? Option A, ring or middle finger. Option B, thumb. Option C, palm. Option D, dorsum of hand. The correct answer is option A, ring or middle finger. The ring or middle finger, lateral aspects of the third or fourth digit, are standard capillary puncture sites in adults. The thumb is avoided due to its pulse, the index finger is often calloused, and the pinky is too small. The palm and dorsal hand are not standard capillary sites. Question 4. The anticoagulant in a lavender top tube is option F, heparin. Option B, EDTA. Option C, citrate. Option D, oxalate. The correct answer is option B, EDTA. Lavender top tubes contain EDTA, ethylenediamine tetracetic acid, which chelates calcium to prevent clotting and preserves cellular morphology, making it the standard tube for complete blood count, CBC, and blood smear preparation. Heparin is found in green top tubes. Question 5. What is the first step in routine phlebotomy procedure? Option A, wash hands. Option B, prepare tubes. Option C, apply tourniquet. Option D, identify vein. The correct answer is option A, wash hands. Hand washing is the absolute first step in the phlebotomy procedure and is required before patient contact, equipment preparation, or any other action. It is the most effective measure against healthcare-associated infection transmission. Question 6. How should a specimen for bilirubin be protected? Option A, light-sensitive container. Option B, from light. Option C, refrigerate only. Option D, freeze immediately. The correct answer is option A, light-sensitive container. Bilirubin is photosensitive and degrades rapidly when exposed to light, particularly UV. Specimens must be transported and stored in amber or foil-wrapped containers to prevent falsely low bilirubin results. Refrigeration alone without light protection is insufficient. Question 7. Which tube is most suitable for stat chemistry tests? Option A, gray. Option B, green heparin. Option C, light blue. Option D, lavender. The correct answer is option B, green heparin. Green top heparin tubes are preferred for stat chemistry because plasma can be separated immediately after centrifugation without requiring a clotting period. SST/red top tubes require 30 minutes for clot formation before processing, which delays stat results. Question 8. Labeling specimens should be done. Option A, before collection. Option B, while patient waits in reception. Option C, at the patient's side after collection. Option D, at the end of the day. The correct answer is option C, at the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 9. Before performing a capillary stick, the site should be cleaned with option A, alcohol swab. Option B, iodine swab. Option C, saline. Option D, sterile water. The correct answer is option A, alcohol swab. A 70% isopropyl alcohol swab is the standard antiseptic for capillary puncture site preparation. The site must be allowed to air dry completely before puncture to prevent alcohol contamination, which can cause hemolysis and falsely elevated results. Question 10. Which is the safest way to remove needle after venipuncture? Option A, recap using one-hand technique. Option B, pull and shake. Option C, recap two-hand technique. Option D, leave in patient. The correct answer is option A, recap using one-hand technique. If recapping is necessary, the one-hand scoop technique minimizes needle stick risk by keeping the free hand away from the needle path. However, best practice is to activate the safety mechanism and dispose directly into a sharps container without recapping at all. Question 11. Hemolysis in a blood sample is most often caused by option A, proper tube mixing. Option B, using a large gauge needle. Option C, excessive force during collection. Option D, inverting tubes 8 to 10 times. The correct answer is option C, excessive force during collection. Excessive force when aspirating blood through a syringe or expelling it into a tube causes turbulent flow that ruptures red blood cell membranes, resulting in hemolysis. Using a large bore needle actually reduces hemolysis risk by minimizing shear stress on cells. Question 12. The term phlebotomy literally means option A, vein incision. Option B, artery puncture. Option C, skin puncture. Option D, blood transfusion. The correct answer is option A, vein incision. Phlebotomy derives from the Greek phlebo, vein, and tomi, incision or cutting, literally meaning the incision of a vein. While modern phlebotomy uses needles rather than actual incision, the term remains the standard descriptor for blood collection procedures. Question 13. Which represents the correct order of draw? Option A, red, green, lavender. Option B, lavender, red, light blue. Option C, light blue, red, green. Option D, green, light blue, red. The correct answer is option C, light blue, red, green. The CLSI recommended order of draw is blood cultures, light blue, citrate, red/SST, green, heparin, lavender, EDTA, gray. Light blue must precede red to prevent clot activator carryover, and EDTA tubes come after heparin to avoid potassium contamination. Question 14. Which of the following is the most appropriate site for a routine adult venipuncture? Option A, femoral vein. Option B, cephalic vein. Option C, radial artery. Option D, basilic artery. The correct answer is option B, cephalic vein. The cephalic vein is a large, accessible superficial vein commonly used for routine adult venipuncture. The femoral vein is reserved for emergencies only due to serious complication risks, and the radial artery is an arterial structure not used for standard blood draws. Question 15. A tourniquet should not be left on a patient for more than how many seconds? Option A, 30 seconds. Option B, 60 seconds. Option C, 90 seconds. Option D, 120 seconds. The correct answer is option B, 60 seconds. CLSI guidelines recommend the tourniquet be applied for no more than 60 seconds to prevent hemoconcentration, which can falsely elevate results for proteins, cells, and other analytes. Prolonged tourniquet application causes stasis and alters sample integrity. Question 16. Which is most important before performing venipuncture? Option A, confirm patient identity. Option B, tourniquet application. Option C, tube selection. Option D, site cleansing. The correct answer is option A, confirm patient identity. Patient identity verification using two identifiers is the single most critical safety step before any specimen collection procedure. Collecting from the wrong patient is a catastrophic error with potentially fatal consequences. All other steps follow identity confirmation. Question 17. The phlebotomist should collect a specimen for glucose analysis. Option A, after eating. Option B, with no fasting. Option C, according to physician order. Option D, always in the evening. The correct answer is option C, according to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2-hour postprandial, or timed draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 18. A phlebotomist notices petechiae on a patient's arm. This may indicate: option A, normal finding; option B, fragile capillaries or platelet disorder; option C, allergic reaction to tourniquet; option D, dehydration. The correct answer is option B, fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 19. If blood is drawn above and fall, option A, results may be diluted; option B, results are more accurate; option C, patient experiences no risk; option D, it's preferred. The correct answer is option A, results may be diluted. Drawing above an active for site introduces for fluid into the specimen, diluting analytes and producing falsely low results. If the same arm must be used, the for should be stopped for at least 2 minutes and blood drawn below the for site after discarding the first 5 ml. Question 20. Which tube prevents clotting by binding calcium? Option A, serum separator; option B, DDTA; option C, citrate; option D, heparin. The correct answer is option B, EDTA. EDTA, ethylenediamine tetracetic acid, prevents coagulation by chelating, binding, calcium ions, which are essential cofactors in the clotting cascade. Heparin inhibits thrombin activity rather than chelating calcium, and citrate also chelates calcium but is used specifically for coagulation studies.